Wednesday, September 1st. We have three agenda items, two septic plans plus a COVID contingency update. So let's start. It's at the first agenda item, 256, 258 North Main Street, Cavanaro Consulting. Is there somebody here from Cavanaro?
Yes, Brendan Sullivan with Cavanaro Consulting.
Hi, Brendan.
There, I just shared my screen. Can you everybody see that?
Yep.
I have the plan up for 256 and 258 North Main Street. So.
Oh, great. Thank you.
Take it away, Brendan.
So this was before you previously, maybe about a year ago, when it was just 256 North Main Street. It has since been, there's always been two houses on the lot, and it has been subdivided. So there's two houses, two lots, one shared septic system. They gave the address to the front house 258, and they gave the address to the rear house is 256. So, and we did tweak the, so what happened here was actually from the last approval, they tore down the existing house that was there, and they're basically moving the house over on the other side of the system, and the field has been moved to the west. So we were able to achieve the 10-foot separation to the new dwelling in the back. So we were able to eliminate that that local upgrade. So what we're looking for now is the reduction in separation of high groundwater, which is proposed is 2.5 feet, required is 4 feet, and also the required reduction in 4 feet of naturally occurring material. The minimum is 2.5 feet. The required is 4 feet. They actually the northern part of the field is where it's the closest to the ledge. As you come to the bottom of the field, there's actually more than 4 feet of separation and more than 4 feet of naturally occurring material. And we're doing this through treatment with a hoot unit in the septic tank, and it's proposed for I believe it's a 7-bedroom, yes, 7-bedroom total design. So I think that's about it.
Okay, great. Questions, Lynn or Robin?
No.
Tell me. Go ahead, Lynn.
Oh, no. I just want to make sure I wasn't on mute. I can't see my mute button. So yeah, I'm good. I don't have any questions. Sorry.
Okay, no problem. So when we approved this the last time, where was the system? And were there upgrades that were required for them at that point?
Yes, they were the same upgrades except for the so basically so in the upper right hand corner, you can see the outline of the existing house that was there. It was stuck way up in the northwest corner of the lot, way up top.
Mm-hmm.
And the field was moved. It was, yes, up in that area there. Yep, that's where the existing house was. So the field was within 3 or 4 feet to the foundation, because of the ledge that was on site. That was really the only place we could fit the system. So when they tore that down and they started building the other house, we were able to move the system. I did a test pit in front of the house and found that there was adequate material there. So I was able to slide the whole system to the west. And that enabled us to get 10 feet of separation to the new foundation. We have 13 feet to the property line on the west side. And it was just a better fit. So we were able to eliminate that local upgrade for the separation to the foundation. But the other local upgrades were still there, the naturally occurring material and the separation of groundwater.
And the separation of groundwater is only 2.5 feet, but he's installing a drip system in here. So that allows for that.
Yep. Okay, I'm good. Robin, do you have any questions? You're on mute, sir. All right, hearing none. Lynn, would you like to make a motion or three?
Or three? Sure. So I make a motion to approve the local upgrade request per 310 CMR 15.4051B to allow a reduction of the required vertical separation between the bottom of the soil absorption system above the high groundwater from 4 feet to 2.5 feet with a 10% reduction in SAS size.
I will second that motion. All in favor? Aye. Robin? Can you come off mute?
Or raise his hand.
Aye.
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 Okay, the motion passes 3-0. Thank you. And now for the upgrade request for the naturally occurring material. I'll make this one. I'll make a motion to approve the local upgrade request per 310-15.4041B to allow a reduction of the 4 foot to 2.5 foot of naturally occurring material.
I'll second that emotion.
Okay, thank you. Can I, all in favor? Aye.
Aye.
Aye. Motion carries 3-0. Finally, I make a motion to approve the septic system upgrade plan for 256 and 258 North Main Street, dated 1/29/2020, revised 8/5/2021.
I'll second that.
Great, thank you. All in favor? Aye.
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 Aye. Motion passes 3-0. Thank you, Mr.
Great.
Sullivan.
Great, thanks very much.
So-
Appreciate it.
Hang on, Brendan, one more thing though. So normally the next day after we approve plans, we write an approval letter and somebody comes in, takes the plans and gets going on this thing. But where this is a shared system, we have to make sure that the proper legal documents are all filed and everything first.
Okay, I believe Rich Henderson was working on that. If he didn't send them to you already, I'll make sure you get those.
Yeah, right.
Um,
So basically it says like we need a copy of this stuff prior to construction of the system. So once we get all that legal stuff in our hands, the easements and the financial agreements and stuff, then we'll officially be able to, hand out the construction permit.
Okay, great, thanks. I'll let them know and I'll get that stuff over to you.
Awesome. Thanks, Brendan.
All right, no problem. Thank you.
Thank you, sir.
Yep.
And just like that, it is 6:40. We are ready for 70 Fair Oaks Lane septic upgrade with Morse Engineering. Who's here with Morse?
Oh,
Oh,
it should be Paul Gunn. Hang on one second. Let me see if he's sitting out in the waiting room. Oh, he is in the waiting room. Yikes. Okay. There he is.
Hi there. Sorry about that.
Hi,
Hi, Paul.
Hi.
thank you,
Can
sir.
you-
The floor is yours for 70 Fair Oaks.
Hey, let me
All right,
share my
thank you.
screen again. Hang on one second. Everybody see that?
yep.
Yes.
Okay.
Yeah.
As previously mentioned, my name is Paul Gunn. I'm a design engineer at Morse Engineering, representing the applicant for the septic upgrade at 70 Fair Oaks. 70 Fair Oaks is an existing 4-bedroom single-family dwelling that is currently served by a 1,000-gallon septic tank and leaching field that is considered to be in failure. The site is located in a FEMA Zone X and is not located in a buffer zone to a resource area, nor in any DEP zone or NHESP habitat. And the site's also located over 400 feet from any open water body. So what we're proposing here to repair this system is the installation of a 1,500-gallon septic tank, a 7-outlet distribution box, and 7 rows of 5 ARC36 low-profile infiltrator chambers. We provided a liner downslope to guard against breakout, and the design includes the rerouting of an existing water service to meet Title V setbacks. In regards to requests for local upgrade approvals, we've requested a reduction in the separation to groundwater from 4 to 3 feet. This request was made so that it was possible to design the system to flow by gravity and avoid the additional cost and disturbance of a pump chamber. The design proposes only a minor change in topography, so there should be no undue effects to the existing drainage patterns. I believe that's all I have. I'll turn it over now to the board for questions and comment. Thank you.
I just have one general question, which is when we talk about groundwater separation, is this groundwater measured, like 3 feet measured? Is it because it's been so wet this season, or is that actually an average measurement over a long period of time? you know what I'm asking?
I think so. Yeah. So that's in regards to the separation from the, the highest point of seasonal high groundwater as determined in the field to the bottom of the system. In perk rates of, greater than 2 minutes per inch, it's a 4-foot requirement. We're asking reduce that to 3 so that we can get the system to flow by gravity.
I got it. I was actually just wondering that, in a drought summer, like last year, for example, I mean, would you need that upgrade request because the groundwater would actually have been lower?
No. So when we use, we use modeling nowadays, the redoxamorphic features in the soil, and that's called seasonal high groundwater because the rust used to, it's essentially rust in the soil. It takes multiple seasons for that to develop. So that's a historic high commonly. So one very bad season shouldn't affect that.
Got it.
And if it did, you'd probably see it in the weeping, but we didn't even have any weeping here. We didn't actually see any water. So.
Got it. Oh, learned something today. Lynn, Robin, any questions?
No,
No,
Great. Robin, would you like to make some
Do you want me
motions?
to- sure.
Somebody?
I will make a motion to approve the local upgrade request per 310 CMR 15.405H to allow reduction of the required vertical separation from 4 feet to 3 feet between groundwater and the bottom of the SAS.
second,
Seconded, thank you. All in favor? Aye.
aye,
Motion carries 3-0.
And I'll make a motion to approve the septic design plan for 70 Fair Oaks Lane dated 8/6/2021 and revised on 8/13/2021.
second,
All in favor? Aye.
aye.
Aye. Motion carries 3-0. Thank you,
Good.
sir.
Thank you very much.
Good work.
Yes. Thanks, Mr. Young. All right. What's next? Okay, agenda. We have 5 minutes before we get to the COVID contingency plan. So let's switch to the meeting minutes from July 27th. There have been a round of edits. Pam and Mary both sent some edits along. I sent some edits along. Lynn, Robin, any comments?
Shoot, I didn't see the last one. Hold on.
The major update that the correction I made was, I believe that with one of the votes for our reorganization was missing, right? So we
Okay.
had the chair, we had the clerk, and then Lynn, I think your nomination and election was missing. So I added that.
Okay.
And I also think that there were a couple items in there that only carried 2-0, even though there were 3 of us present. And I'm pretty sure everything was unanimous. We'd have to go
Yes.
back and confirm that, but so those are the updates that I made.
Okay. Then they look good.
Okay, can I get a motion to accept them?
I move to accept the minutes of the Board of Public Health meeting, July 27, 2021.
Thank you. And a second?
I'll second it.
Great. All in favor? Aye.
Aye.
Motion carries 3-0. When shall we get together next, colleagues? September 1st. Pam, do you have a sense for the load coming up in terms of?
I don't think in terms of like septic, I don't think we have anything, do we, Amy?
Do we meet before October 1st in case for any sort of mask mandate updates, right? We said we would meet
Yeah.
monthly, and October 1st is when supposedly the state is going to lift the mandate for, was it for towns that are 80% vaccinated?
Yeah.
So maybe the week before that. I'm out of town through the 20th or 21st.
We could do the 29th, right? Which is the one, or the 28th or
That's a
29th.
Wednesday. Yeah, what works for you, Pam and Mary?
Well, we like Tuesdays because we're there anyway.
Oh, good. Okay, that's fine. The 28th
Yeah,
works for me.
Mm-hmm.
Robin, does the 28th look okay for you?
Looks good now.
Sweet. So let's say 6:30 p.m. on
Can
Tuesday.
we make it 6 or 6:30 still better for everyone?
It's either's fine.
So now that I'm remote, I can make a 6 o'clock. I don't know, Mary and Pam, do you prefer
Be
one or the other?
great for me, you know, because we stay till 7 on Tuesday nights. So,
Okay.
you know, if you want to do it 6 o'clock, that'd be great.
Fine by me.
Fine by me.
6
Robin, are
o'clock,
you good with
okay.
that?
6 is fine.
All right, so it'll be 6 o'clock on the 28th of September.
Perfect.
All right. 6:48. Okay, so what's next? Pam, could you give us your report?
So far this week, one of the interesting things was we had a meeting with 2 people from DPH today to talk about the Public Health Excellence Grant. Mary and I both attended. And it was just to kind of talk about what their expectations are and what we were thinking it was going to be. And we kind of learned that really DPH is trying to promote shared services to fill in gaps. And it's going to really be the future. I mean, they're not going to go backwards. And so they were saying that, you know, if we wanted to try to recruit any more towns, the incentive might be that they would have even more money for us at some point. Like, let's say we pulled in Norwell and Situate, maybe instead of getting 300,000 a year, maybe we could get 500,000 a year. But they didn't seem, the other 2 towns didn't seem particularly interested. So I was saying, like, why don't we just wait, you know, implement this for a year, see how it goes, see how, you know, what's good, what's bad about it, and then maybe next year try to pull in some more towns. But they definitely want to incentivize it to make it to do more regionalization and more shared services and stuff. And the important thing is that we're all the towns that we are involved with now currently, we all can meet our regulatory requirements. Like, we're doing 2 rounds of food inspections each year. We're doing perk tests and reviewing septic plans. So we're getting all like the real basics done. It's like, what can't we do? And, you know, the places that we're coming up short is like things like the social services type of stuff. And even like things like contact tracing and stuff, we could probably use some more help. So those are the kind of things that they want to share, or we want to share. So they were really good. They were very supportive, and we haven't actually signed anything yet, but we're getting close, and it's actually kind of getting exciting. I think it's going to really be a good thing. That's the biggest thing. Oh, and we had a meeting, Jason and I, with our consultant, our geologist that's helping us with the Cook Estate. We got a really disappointing report from this Green Environmental that's working for the Cook Estate. Their report, you know, it showed that there's some real limitations with the soils out there in terms of trying to have septic systems. Like, it's this really tight till where water really can't move through the soil, and that's why they're having problems. The water really can't penetrate, and it's, you know, if you've got these tight layers and the rain comes down and it starts building up, and then you start adding wastewater on top of that, it starts building up, and you get this big mounding effect, and at some point the water has to go somewhere, so it's coming out the side. And the report by this Green Environmental, basically all they did was put in like the not statistics, but the facts of their well investigation. You know, they put in boring logs and things, and they never really came to a conclusion like, this is not a site for a septic, a leaching field. You know, they never really did anything other than present you the data. So our consultant, I think, is going to say, like, look, you guys have to take this next step and do groundwater contours and cross sections. Otherwise, it's this whole report, it's meaningless without that. The only way that we can say for sure that these leaching fields fail, well, we already know 2 of them failed. The only way we could say even 2 of them are salvageable is if they're not sitting in groundwater. And at this point, the way they just threw this data at people with nothing else, you really can't make a conclusion. So unfortunately, it's a really frustrating process, and we're still mucking through it.
Who commissioned that work?
Well, the Cook Estate, and so we encouraged them to do that. So they found a consultant, and it was just one single guy, one engineer, and he wasn't qualified to do it. So he contracted with this Green Environmental, and I'm sure they're doing it by cost, right? And you always say like you get what you pay for. So they found this little environmental engineering firm, and they went out and pulled this thing together, and we're looking at tables, and we were laughing, saying like, a co-op could pull together better tables than these people, but I don't know. It's their money, and unfortunately, we can't really tell them like, look, you got to get a better engineering firm to do a better job. But I don't know.
We can tell them that we don't have the data that we need to.
That's what we're gonna do. So we have a guy from Weston and Sampson that's working for us who's really good, and he's just going to pull together a memo and saying these are all the deficiencies with the report, and this is what we need to have in order for us to make any kind of conclusions. We have to do the cross sections and groundwater contours. You got to provide that. Now we could ask Kevin to do it, and then the town would end up paying, but that's not really right.
No. The other topic that had come up in the context of the Cook Estate, as I recall, was, well, what's going to happen with that Stop and Shop plaza? Will that get tied into town sewer, and therefore could that potentially tie the Cook Estate into that? Is that gone anywhere?
So that actually I'm glad you brought that up. So that was another thing. They had a sewer commission meeting this week, and both parties are getting ready to sign. They're doing the final reviews of a sewer agreement, and that plaza is definitely going to connect to sewer. So the problem is I don't think the Cook Estate would want to go through an easement through there, because they would end up paying this guy, and I don't think they want to do that. And they are sitting in a position where they could get sewer through a different route. They could get it directly through the Dare Hill School. Where they're sitting, there's another route to go. So I think if they had to, that's the way they would go.
I see.
But that's to be determined at some point.
So Pam, for that, because you brought it up, are we still being sued as the Board of Public Health?
Lynn, thank you for bringing that up.
I found
I need to follow up with that thing. Thank you.
Yeah, thank you for following up.
Yes, I need to make sure that the town doesn't sign anything until that gets dropped. You're awesome.
Good, I'm glad I brought it up.
Who is the agreement for Stop and Shop for the quote their sewage system? Well, what can you explain that?
Wait, what's the question?
You say the Stop and Shop is about ready to close on some kind of sewer
Yeah.
success? Who is it with? With the town?
Yeah, with the town. With the
Okay.
town of Cohasset. So the town of Cohasset Sewer Commission has struck a deal with the lawyers for the developer,
Okay.
that plaza. So 380 with the failed system, 390 the new construction, and 400
Okay,
Stop and Shop. All three properties will be tied into a sewer that's going to come up 3A. The sewage will flow down 3A and to like a pump station at Tupelo Road, and then get pumped from there up to the treatment plant.
So somehow they found excess capacity.
Yep. I'm not sure. Some of it may get diverted to Hull. I don't know. But yeah, they did somehow. They found some excess capacity.
And then the state has signed on that, I take it?
Well, the state doesn't really have to sign off on this. There's still an open enforcement order going on with the state with this guy, and it won't get closed out until he's officially hooked up to sewer. And then at that point, they will sign off on closing out that enforcement order.
Okay.
So my understanding is that a fine was issued of $10,000 or close to that for the whole violations of dumping chemicals at 380 CJC.
Yeah.
But
Okay.
yeah.
I hear crickets at someone's house. It makes me so happy. Can you, I don't know.
We have them in town hall now, which is not a good thing. They're
No, that's not a
downstairs in
good
the
thing, yeah.
basement.
Not a good thing at all.
We can hear them all day now.
Oh, that's great. Okay, anything else, Pam?
No, that's it for me.
Okay, thank you. So COVID contingency plan. Per our order, at each monthly meeting, we're going to take a look and see what the stats are for the town, where we land in the color coding, and we're still green, as I see. We need to be both green or gray, and we need to have both Norfolk and Plymouth County out of the higher substantial ranges, and I believe they are both still in the high range. So
Yes,
the mandate
they are.
stays in effect just by virtue of that. So I don't know that we need to talk about it. I was going to just sort of express for the record my dismay of the state letting us go through that extremely painful process over that week, and then deciding that they were actually going to mandate it for the schools. I mean, it is what it is. But I guess, so now we basically take a look at the town, is it the school-wide vaccination rate on October 1st, correct? Or building-wide vaccination rate on October 1st, and they decide building by building if they can raise the if they can lift the mask mandate for that
Yeah.
building?
That's my understanding. And if the high school was just a high school, I think they'd be able to do it.
Mhm.
But where they have middle school kids, probably not,
I
especially
thought
the
they
sixth graders.
separated it though. Didn't they separate it to middle school and then high school? Like, isn't it officially
It is
different?
separate, but there's some overlap, and that's the
Okay.
concern.
Yeah.
I have a question, if you could.
Yeah.
One of your documents indicated that universal masking implemented for all town, including businesses, and it lays out the criteria for schools. Shouldn't there be some other sentinel areas, such as maybe town hall or DPW? I mean, why, I don't understand how the schools
Uh,
are the
The-
ones
the
that run the show.
Yeah, the
So,
reason is
Michael-
because the state mandate is for the school systems, right? For K-12. So the state Board of Ed has basically said K through 12 universal masking, unless it's unless 80% within a building it's 80% or higher vaccination. Now, presumably, if the state requirement was satisfied, then we'd revert to the standing order from the Board of Health, right? And then we would have to decide if we were going to lift the mandate for the schools. So it's sort of like the state rule, the state requirement sort of overrides what we did. So right now, our mandate really only applies in effect to other town buildings, so town hall and the rec center and other things like that.
Right.
And the sentinel for that is actually the county and the county infection rate and the town infection numbers that's written in the order. Does that help?
Okay, thank you. Yeah.
Yep.
It still seems that the schools are being depended upon to run a masking order for the whole town.
Well, it turns out that actually the masking for the whole town, well, actually, if in essence, the almost 60% of the unvaccinated population are in the schools. So it actually it's actually kind of consistent, right? Because we're basically saying unvaccinated folks have to mask, and in most cases that applies to the schools, certainly the two elementary schools. Mary, did you want to say something?
Yeah, I did. So on Monday, Chris Senior and Miriam and Chief Sylvia, Pam, myself, we had a meeting about masks in town hall in particular. What we're seeing now is breakthrough cases. So people are vaccinated, but they're still getting COVID. So they're considered a breakthrough case, but we now have close contacts who are exposed, they're vaccinated. The guidance says, if you're fully vaccinated and you're exposed, you don't have to quarantine. So how does that affect town hall, right? Because we have a couple of staff members who are now close contacts. So we had this meeting Monday, and Chris Senior made it a policy that you have to wear a mask in municipal buildings. So town hall, elder affairs, library, rec center, basically.
Irrespective of vaccination status.
Yeah, yeah.
Yeah, seems to me we could add a clause, either or, an unvaccinated person or somebody who has been infected by the Delta variant or some other variant.
Or
And that
close
would
contact
cover-
of it. Yeah.
And that would cover more than just what we have now. That makes sense.
Does it maybe does the rule that it would be hard to enforce that, I think. But
Well,
I'm
the
thinking
thing
about
Not
is-
everybody gets tested for what
The thing-
variant they have.
Yeah,
Yeah.
the thing is, right now, they don't send all specimens for sequencing, so we don't know. We do know Delta variant's responsible for 80% of the cases, so, yeah, I don't know how you could enforce that.
So Mary, do we know every time somebody's infected, whether or not it's a vaccinated person?
Yes, well, that's part of the investigation. You ask them that. But we also have the information in our MIIS system, so we can look them up. But yeah, that's part of it, so. And we've had 12 cases in the last 2 weeks, and 10 of them are breakthrough cases, so.
So I guess the take-home message is, you know, so that I'd be interested to see now that we've been, 6 weeks, 8 weeks past the point where it's like, oh yeah, it's 99.99% are not infected. Now I think to have to find out we should know what that number is now, but also recognize that now it's about severity, right? And it's about hospitalization, and I honestly believe that we're moving towards a time where this is just going to be another manageable disease that we deal with every season, like the flu, right? You just get your vaccines and you just hope that that's going to give you protection to keep you well. So,
And I think we're also moving towards more of these at-home test kits.
Yeah.
So people will be able to test at home, and we may not know who's positive, right? You're going to test, follow the guidance, and on you go. So we are definitely moving towards that.
Yeah. So from businesses in town where we made the mask recommendation and provided signage, and have we gotten any feedback from any of the businesses, or any blowback at all from town employees or anything like this?
The mask order just went into effect yesterday in town hall, and no one's had an issue with it.
But I mean, the Board of Health order went in the week before.
Right.
I was just wondering. So I guess no one was really surprised by it. I guess. Oh, Chief, you just came off mute. Would you like to say something?
No, just as Mary mentioned, we all met on Monday, and the conversation was about the breakthrough cases and the fact that the CDC guideline very simply said that you didn't have to quarantine, you just had to wear a mask and monitor your symptoms and get a test 3 to 5 days out. So that was the driver behind the mask, we'll call it a mask mandate, or what Chris did with the town buildings, so that we're trying to contain what Mary was seeing as far as things that were happening. And I think we had 5 employees that were at that point all considered to be close contacts. So that's what we were trying to do. And we included public safety in that. So every town building is being treated the same way. And the thought process was that as long as we're in that high transmission zone, that will remain in effect, and hopefully we'll beat this back a little bit, and then we can revisit how we handle our actual employees, and more importantly, people that come in, and it's just that thought process. We don't know who might be infected, so that was just the driver behind it. Just wanted to add that.
Right. Thank you.
I would actually would hope that either the state or the CDC would change the guidance and say, if you're a close contact, even if you're vaccinated, you should quarantine. Because I think vaccinated people are getting COVID.
Yeah,
So.
and I wonder, with varying severity, right? And with, as right now, unknown transmissibility, right? Or for how long? Like, how long do we need to quarantine someone who's been vaccinated, right? Do you really need to quarantine for whatever 10 days or is it even less now? I
Well,
wonder
if-
if there's data, if
Yeah.
there's any data yet on that.
Yeah, no, I mean, it's still the 10-day, but you can test on day 5, and then if it's negative, come out after
see.
day 7.
Is that just for vaccinated folks?
No, that's for everybody.
I got it.
Yeah. But that said, you should still monitor yourself, right, for 14 days to make sure you don't develop symptoms.
Right. Right. Okay. Anything else COVID?
No.
If not, we can, it's all COVID all the time. So Mary, would you like to talk through your report, or did you want to?
Well, you know, I think you get my reports. Numbers are staying steady. You know, they're gradually climbing up each week. We'll be at 12 this week. Yeah, so other than, you know, what's in my report, yeah, that's about it. It's just on goes the battle. Now we're
Yep.
thinking about flu. And the next thing will be booster doses for COVID. And I just filled out a survey today saying, are we interested in, you know, vaccinating? And I said yes. And, you know, they want to know who we would vaccinate. And so we'll be on the list to get COVID vaccine, which I think is a good idea to do our seniors and our first responders, our public housing, you know, so.
Yeah, Mary, are we going to do some kind of inoculation of both people with underlying conditions and also for the booster, which I assume is the same formulation, just segregated out by different groups. Is that correct?
Yeah, they're not giving us the option of participating in the that first round of third doses for the immunocompromised. They're giving us the option to participate in the booster shots.
Okay. So people still can just go to CVS or Walgreens and,
Yep, yeah.
okay. Thank you.
Okay, Mary, when I was reviewing the minutes from the end of July, it was about the encampment. Has anything come about the encampment out in the Whitney Woods?
So the encampment, they were issued an order that they had 2 weeks to leave the property, or else they'd be found to be trespassers. And I believe the 2-week period is up, and I was told today that someone came out of the woods with their bike and a big cart. So I don't know if they're still there or not.
Okay. It was worrisome. Okay, thank you, Mary. I don't have any reports as chair. I've done enough talking. Does anyone have any other business we'd like to talk about? Otherwise, we can move to adjourn.
Okay, I'll make a motion to move to adjourn.
I'll second that motion. Oh, I beat you. All in
Beat you to
favor? All in favor? Aye.
Aye.
Okay, unanimous 3-0. Thank you, everyone. Have a great night.
Thank you.
Thank you.
Stay